Breast cancer treatment is the most common reason for lymphedema in the United States. Lymph node removal and radiation are the main risk factors. However, obesity and also having an extensive surgery, for example, having a mastectomy over lumpectomy, are also known risk factors for lymphedema. My name is Barfin. I'm a doctor of physical therapy and I specialize in oncology and lymphedema. And in this video, I will show you how to do self-lymphatic drainage for breast and or arm lymphedema. Lymphatic drainage is a great way to stimulate the lymphatic system and also reroute that fluid that's sitting in the affected arm to the healthy lymph nodes in the opposite armpit and also in our groin, so that fluid can be reabsorbed back into the system. Keep in mind, swelling, especially in the upper arm and the chest region, is expected up to 3 months after your surgery. But if you have swelling more than 3 months, then you should notify your team and also see a certified lymphedema therapist to be evaluated for lymphedema. Some signs and symptoms of lymphedema include swelling that usually starts at the end of the segment. So if you have arm lymphedema, your swelling will most likely start in your hand or in your forearm. This process is usually very slow, so you won't be having swelling overnight. Additionally, lymphedema tends to be painless unless you have another underlying condition that is causing the pain. As your swelling gets worse, you might feel some skin changes, like your skin becoming harder and tighter, especially compared to your unaffected arm. Before you even see any swelling, you might feel some discomfort and heaviness in the affected arm. One great way to screen for lymphedema before you see any visible changes is looking at the bony landmarks. In order to check for that, you can make a fist with both hands and put them side by side. If your knuckles on your affected side are less visible than your unaffected side, and additionally you have that feeling of heaviness and discomfort on your affected arm, then those might be very early signs of lymphedema. And in that case, I would recommend notifying your healthcare team and seeing a certified lymphedema therapist. So now if you're ready, let's practice lymphatic drainage. So we'll start with the neck to stimulate the lymph nodes that sit in this space right here. We're going to go ahead and place the palm of our hand on our collarbone, and we'll be using our entire hand. Most people only use their fingers, but it's a lot easier to use the entire hand, and it will give you more control over the movement. So we're going to apply gentle pressure. Stretch the skin back in this direction towards the fingertips, in towards the thumb or your neck, and release your pressure so your skin can bounce back. Again. So focusing on that half circle, make sure after the half circle you release the skin instead of pulling it back to its place. We'll do this 5 to 7 times. It should not be painful. And then we're gonna repeat the same thing on this side. Next, we're gonna do the deep abdominal technique. If you are pregnant, on your menstrual cycle, or have any diarrhea or inflammatory bowel disease, then you should not be performing this part, so just skip to the next one. And even though I will be standing up to show you guys how to perform this technique, you should be doing this either lying down with your knees bent or seated so your core muscles are fully relaxed. So we're going to place our left hand right above our left hip bone, and with this technique we're gonna do a scooping motion where we'll press the palm of our hand down towards our abdomen and then press down with the fingertips, so it's more like a wave motion like this. Again, with this we're also doing 5 to 7 repetitions. Don't forget to sit or lay down with this one. After 5 to 7 reps, we're gonna move on to the right side. Place your right hand right above your right hip. We're gonna press the palm of our hand down and then the fingertips. Again, 5 to 7 reps on this side as well. Next, we're gonna do the right upper quadrant. We're gonna place our hand right below the ribs and we're gonna do 5 to 7 here as well. Now we're gonna do the middle, right above your belly button. And then we're gonna do left upper quadrant. Hand placement is right below the left ribs. We're doing the scooping motion, press the heel down and then the fingertips. We're here for 5 to 7 reps as well. And we're gonna end with left lower quadrant where we started. So left hand right above the left hip. We're gonna do another 5 to 7 reps here before we move on to the diaphragmatic breathing. Next, we're gonna do diaphragmatic breathing. We're gonna put one hand on our belly, the other one on our chest. There are two things we're going to pay attention to with this type of breathing. One, we're breathing in with our nose while breathing out with our mouth. And the other thing is we'll be doing belly breathing, meaning we're going to try to keep our chests as still as we can while breathing in with our belly, almost as if you're trying to look pregnant. So we're going to go ahead and take a deep breath in through our nose. Keep your chest still. The stomach should be coming out. Hold that breath in for a second and breathe out. And let your stomach fall in instead of contracting it in. We're going to do this 8 to 10 times. Next, we're going to move the fluid across our chest from the affected area to the unaffected armpit. For the purpose of this video, I'm going to have my right arm as my affected side. So we're going to place our hand on the unaffected armpit where we did not have the lymph node removal. So we're going to go ahead and stretch the skin towards the back. So we're moving in the direction of our fingertips and towards our thumb, and then we'll release that pressure so the skin can bounce back. So we're gonna do 5 to 7 times. For comfort, you can place your hand behind your back. So we're gonna go ahead and do this half circles, stretch the skin towards the fingertips, towards the thumb, and release. Again, we're doing 5 to 7 times with this as well. Next, we're going to work on the side of our trunk in order to bring the fluid up towards the healthy lymph nodes so it can be reabsorbed back into the system. You can have your arm behind your neck still, but if that's too difficult or painful, you can just rest it on something. We're gonna continue with the half circles. So we're gonna place our hand on the side of our trunk, stretch the skin towards the thumbs, up towards the thumb, and release. And then we're gonna move towards the armpit. Again, you should be doing this on your skin, not over the clothes, and make sure there's no lotions or oils on your skin, which is gonna prevent you from stretching your skin. Again, we're gonna do 5 to 7 times with this. So this will be 1 time, 2, 3, 5 to 7 times like this, bringing all the fluid towards your unaffected armpits. Work your way up all the way to the armpit. Don't stop halfway there. Good. And then next we're gonna move it across our upper belly. We're gonna start from the affected side and move towards the unaffected side. So with this one, we're only stretching forward. So since my affected side will be the right side, I'm gonna start on the right side, and we're gonna stretch the skin forward and release. Move closer, stretch, and release. Just like this. Again, this technique also requires 5 to 7 reps. And lastly, for the chest area, we're going to be working on the upper part of the chest. The same thing, we're going from the affected side towards the unaffected side. You can use the same technique with this. Place your hand on your chest, so we're right above the breast. We're going to go ahead and stretch the skin towards the unaffected side and release. Again, we're doing 5 to 7 times. This will be 1, 2, 3, 4, 5. And with this one too, you want to come all the way from the armpit to the opposite armpit. Even though my microphone is in the way and I can't get in there, you want to cross the entire length. Now we're done with the chest part. We're gonna move into the groin. So first, we're gonna stimulate our lymphatic nodes in the area. We're gonna use the half moon technique for this one too. We're gonna put our hand right where our thigh meets our pelvic bone. From here, we're gonna go ahead and stretch the skin towards the fingertips and up towards the thumb. We're gonna do this one also for 5 to 7 times. And then we're gonna go ahead and bring this fluid down to the groin area. We're gonna work all the way from the armpit to the groin, the entire length. And we're doing the half moons again. So we're gonna stretch the skin towards the fingertips, so we're going back, but this time we're gonna go down towards the groin instead of going towards the thumb. So stretch the skin back towards the fingertips and then pull it down, then relax and let your skin bounce back. Move down a little bit, stretch the skin towards the fingertips, down and release. Back, down, release. Back, down, release. Another technique you can do with this one is just stretching your skin down. So you're going to go ahead and stretch the skin down and release it. Try to bring it to your groin area, so it's not just going down on the side, but we're kind of coming forward towards this area. We're also going to do this 5 to 7 times. This will be 1 time, 2 times, and then after you're done with that 5 to 7 repetitions, we're gonna move into the arm. So we're gonna split the arm into 3 areas, which is gonna be the upper arm, forearm, and the hand. First, we're gonna start with the shoulder. We're gonna place our other hand in front of the shoulder, and we're gonna do the half circle. So we're gonna stretch the skin up towards the fingers, stretch it in towards the thumb, and then release the skin so it can bounce back. We're gonna do this 5 to 7 times as well. After the shoulder, we're gonna move into the upper arm. And we'll start with the outer part. We're doing the half circles again, so we're gonna place our hand here and we're gonna stretch the skin back, up, and release. Back, up, and release. Again, we're doing 5 to 7 times. And then we're going to do the inner arm, where we'll be moving that fluid from inside of the arm to the outer part. So we're going from in to out direction. So we're going to place our hand inside of our arm and we're just going to move the fluid in a forward motion. So stretch your skin towards your fingertips and let it bounce back. We're going to cover the entire arm 5 to 7 times. And then after we're done with the inner part, we're going to go back to the outer part and bring that fluid up one more time with the half circles. Next, we're going to move into the elbow. We're going to start with the inner part of the elbow. We're doing the half circles, so we're going to place our hand, stretch the skin towards the fingertips, up towards the thumb or the shoulder, and release it so it can bounce back. We're going to do 5 to 7 times. And we're going to do the inner elbow. Again, half circles. Stretch the skin up and in towards the fingertips and the thumb, and then let it bounce. 5 to 7 repetitions here as well. And then we're going to do the outer elbow. Again, we're doing the half circles. Stretch the skin towards the fingertips, thumb, and release. And we're here for 5 to 7 reps as well. We're gonna do both the outer and inner part with the forearm as well. First, we're gonna start with the inner part, where we'll just bring the fluid up. So we're stretching the skin directly up towards the elbow. You can rest your arm on a surface with this if you want, because sometimes it can be difficult to hold it up, especially if you have lymphedema or if you have any rotator cuff issues. So we'll do this for 5 to 7 times as well. And then we'll move into the outer part. We're doing the same thing. So we're going to start at the wrist, stretch the skin up towards the elbow, and release it for it to bounce back. We're here for 5 to 7 times as well, so that was 1. Next, we're going to work on the wrist. We're going to place our hand on top of our wrist bone, and from here we're going to stretch the skin in the direction of the fingertips and up towards the elbow and release. 5 to 7 times here as well. You can also do it in this direction if this is easier. So I'm going in the direction of the fingertips, and in this case down towards the elbow, but we're doing the same thing 5 to 7 times. And then moving on to this outer part of the hand. The same thing with this, we're doing half circles, so we're gonna move the skin in the direction of the fingertips and up towards the wrist. We're here for 5 to 7 times as well. After 5 to 7 reps here, we're gonna move into the fingers. So for the fingers, you can actually use 3 fingers, where you place your thumb on the inner surface and your index and middle fingers on the outer surface of your fingers. And from here, you're gonna stretch your skin down towards your knuckles and relax. We're gonna do 5 to 7 times with each finger. And then we're going to do everything in reverse. So starting with the hand first, stretch it towards the fingertips, up towards the wrist. I usually keep everything to 5 repetitions when I'm working my way back, but feel free to do 7 times or more if you need to. And next we're gonna do the wrist, stretch it towards the fingertips and up towards the elbow, about 5 times as well. And next we're gonna do the forearm. You can focus on the outer part. I'm gonna do it just 1 time for the purpose of this video, but you can do it 5 times. Don't forget to do the elbow, stimulating everything here again. Then we're gonna do the inner part, bring the fluid towards the outside of your arm. And then we'll bring the fluid up towards the shoulder, and then we're gonna bring it across our chest towards the healthy lymph nodes in the other armpit, and then we're gonna bring it down towards the groin. And that was a full drainage routine for breast or arm lymphedema. Thank you so much for watching, and hopefully you found it helpful. Please feel free to share it with someone who can also benefit from this routine. And don't forget to subscribe if you want to see more content like this. If you want to learn more about lymphedema and cancer rehab, you can find me on Instagram. And if you're someone who wants to get back to exercising and fitness after your cancer treatment, you can also join our private cancer fitness Facebook group. Both of these links can be found in the description below. Thank you so much again, and see you in a different video.